The shocking exercise order doctors never tell hypertension patients. 1 in 3 adults worldwide suffers from high blood pressure. If you're taking blood pressure medication right now, you might be risking your life with the wrong exercise sequence at this very moment. A groundbreaking study by world-renowned cardiovascular specialists has revealed a shocking truth when hypertension patients perform exercises in the wrong order. Their blood pressure can spike to over 200 millimeters of mercury instantly, increasing stroke risk by a staggering 340%. What's even more alarming is that most medical professionals fail to explain the critical importance of exercise sequencing to their patients. They simply recommend aerobic exercise without providing specific guidelines on when and in what order to perform different activities. The deadly exercise trap hypertension patients don't know about. Research conducted by leading international sports medicine experts has confirmed that blood pressure response patterns during exercise are completely different between healthy individuals and hypertension patients. While healthy people experience gradual blood pressure increases with higher exercise intensity, hypertension patients suffer dangerous pressure spikes when starting intense workouts at the wrong time, particularly between 6 to 10 a.m. and 6 to 8 p.m. Hypertension patients who suddenly begin high-intensity exercise experience concentrated severe side effects. These time periods coincide with peak cortisol and adrenaline production, and when vigorous exercise is added to already elevated blood pressure, blood vessel walls face unbearable pressure. Even more shocking is that many hypertension patients jump straight into main workouts without adequate warm-up. According to research published in prestigious international medical journals, 85% of hypertension patients who started exercising without warm-up exceeded 180 millimeters of mercury systolic pressure within 3 minutes of exercise initiation. The secret exercise sequence for safe blood pressure management. So what exercise order should hypertension patients follow? Here's the scientifically verified safe exercise sequence, based on clinical trials conducted by world-class medical research teams. The first stage requires a minimum 15-minute comprehensive warm-up. Unlike standard warm-ups, hypertension patients need a special sequence. Begin with 5 minutes of slow walking at 70% of your normal walking pace. The next 5 minutes focus on upper body stretching. Progress through neck, shoulders, and arms in that order, holding each position for at least 10 seconds without bouncing. Large-scale internationally validated cohort studies confirm that excessive stretching during this phase can actually increase vascular resistance and raise blood pressure. The final 5 minutes involve gently loosening lower body joints. Perform ankle rotations, knee lifts, and light squats for 30 seconds each. This process enhances lower extremity vascular flexibility, preparing for smooth blood circulation during exercise. The second stage begins with low-intensity aerobic exercise. Many people try to exercise at high speeds from the start to maximize benefits. But this is fatal for hypertension patients. Leading medical university research shows that during the first 10 minutes of exercise, heart rate should not exceed 50% of target maximum. Specifically, start with brisk walking or light jogging intensity, monitoring body response, while gradually increasing intensity. The key is utilizing the perceived exertion scale. Begin at level 3 to 4 on a scale of 1 to 10, representing light intensity. The third stage allows for full aerobic exercise. However, caution remains essential. Analysis by recognized medical expert groups indicates that hypertension patients should maintain exercise intensity between 60% to 70% of maximum heart rate for safety. Calculating maximum heart rate is simple: subtract your age from 220. Multiply by 0.6 for the safe lower limit and 0.7 for the upper limit. For example, a 50-year-old hypertension patient has a maximum heart rate of 170, with a safe exercise heart rate range of 102 to 119 beats per minute. This stage can last 20 to 30 minutes, with walking, cycling, and swimming being most suitable as they utilize large muscle groups. Swimming is particularly recommended as water pressure reduces vascular burden, making it the safest exercise for hypertension patients. Proper timing and methods for strength training. Many hypertension patients either completely avoid strength training or attempt it dangerously. However, global medical research team meta-analysis confirms that properly performed strength training actually helps long-term blood pressure control. The fourth stage of strength training should begin after at least 5 minutes of rest following aerobic exercise. Wait until heart rate returns to stable levels during this rest period. The key to strength training is repetition, count and breathing technique, not weight. Large-scale clinical trials by world-class medical professionals confirm that hypertension patients should use light weights at 40% to 50% of maximum strength for 15 to 20 repetitions for optimal safety and effectiveness. Crucially, never use the Valsalva maneuver. This breathing technique, where you hold your breath while increasing abdominal pressure to lift heavy objects, causes dangerous instant blood pressure spikes. Instead, exhale slowly during the exertion phase and inhale while returning to starting position. Strength training should progress from large to small muscle groups: legs, back, chest, shoulders, and arms, with 1 to 2 minutes of adequate rest between each body part. The hidden importance of post-exercise cool-down. The fifth and final stage, cool-down, is often overlooked. Recent sports medicine research shows that hypertension patients who skip proper cool-down frequently experience acute post-exercise blood pressure elevation. Suddenly stopping exercise can cause blood pooled in peripheral vessels to rush back to the heart, potentially causing dangerous pressure spikes. Therefore, a minimum 10-minute cool-down period is essential. During the first 5 minutes of cool-down, gradually reduce exercise intensity while walking slowly. Progressively decrease stride length and walking speed until heart rate stabilizes. The next 5 minutes involve static stretching to relax tense muscles. Focus on major muscle groups used during exercise, holding each position for 15 to 20 seconds. Maintaining deep, regular breathing throughout this process significantly aids blood pressure stabilization. Time-based exercise strategies and precautions. Exercise timing is also crucial for hypertension patients. Research by recognized medical experts identifies 10 a.m. to 4 p.m. as the safest daily exercise window. This timeframe represents a relatively stable period in blood pressure's circadian rhythm, with lower stress hormone secretion. Early morning or late evening exercise should be avoided when possible. For morning exercise, wait at least 1 hour after waking. Blood pressure naturally rises immediately upon waking, making sudden exercise extremely dangerous during this period. Meal timing around exercise also requires attention. Research published in prestigious international medical journals confirms that exercising within 2 hours of eating can cause significant blood pressure fluctuations. Finding your personal exercise intensity. Not all hypertension patients can apply identical exercise intensity. Appropriate intensity varies based on individual blood pressure control status, medications, and comorbid conditions. Leading medical university research provides this personal intensity measurement method. Measure blood pressure and heart rate at rest, then, after 5 minutes of light exercise. If systolic pressure rises more than 20 millimeters of mercury, reduce intensity. If changes are under 10 millimeters of mercury, gradually increase intensity. Carefully monitoring subjective symptoms during exercise is also important. Chest tightness, headaches, dizziness, or excessive breathlessness require immediate exercise cessation and adequate rest. For patients taking blood pressure medications, exercise planning must consider drug action timing. World-class cardiovascular specialist research shows most blood pressure medications reach peak effectiveness 2 to 4 hours after ingestion, making this the safest exercise window. Lifestyle improvements alongside exercise. Exercise alone cannot completely manage hypertension. Global medical research team meta-analysis confirms that combining exercise with dietary control, stress management, and adequate sleep maximizes benefits. Pre- and post-exercise nutrition management is particularly important. Eat lightly 2 hours before exercise while avoiding high-sodium foods. International Research Institution analysis shows that exercising after high-sodium food consumption increases blood pressure elevation by an average of 15 millimeters of mercury. Within 30 minutes post-exercise, consume adequate fluids with potassium-rich foods. Bananas, oranges, and potatoes help balance electrolytes and stabilize blood pressure after exercise. Sleep quality significantly impacts exercise effectiveness. World-class research team clinical trials confirm that hypertension patients getting 7 or more hours of adequate sleep show 40% greater blood pressure improvement from exercise. For more health information, please subscribe, like, and set notifications to join us. We'll continue providing verified information for your healthy life.